Do you frequently feel like your heart is racing or you're unusually tired, even after a full night's sleep? What if you've been feeling dizzy or your memory isn't as sharp as it used to be? These could be signs your body is missing something essential, like vitamin B12. Pernicious anemia is a type of anemia where your body can't absorb enough vitamin B12 from food, leading to a drop in red blood cells. Think of red blood cells as delivery trucks carrying oxygen to every part of your body. Without enough B12, these trucks aren't made properly, so your organs and muscles don't get the oxygen they need. That's why you might feel weak or breathless doing simple tasks like climbing stairs. So why can't your body absorb B12? The main cause of pernicious anemia is a problem with a protein called intrinsic factor. Imagine intrinsic factor as a special key your stomach produces to unlock vitamin B12 from food. Without this key, B12 stays locked in your digestive system and passes out unused. In many cases, the body's immune system mistakenly attacks the stomach cells that make this key. This is called an autoimmune disorder. It's like your body's security system is confused and starts destroying its own staff. Other causes include stomach surgery that removes parts producing intrinsic factor or long-term vegetarian, vegan diets with no B12 supplements, since B12 is mainly found in animal products. How do you know if you might have pernicious anemia? Let's play detective. Have you noticed your skin turning pale or even slightly yellow? That's a clue. How about feeling pins and needles in your hands or feet, like tiny ants crawling? That's nerve damage due to low B12. Another sign, feeling depressed, confused, or forgetful. Your brain needs B12 too. Some people feel so weak they can't stand for long, or get breathless washing dishes. Mouth ulcers or a sore red tongue, that's another tip-off. One person might say, "Doc, I keep dropping things, my hands feel clumsy." Another might say, "I feel fine, but my blood test showed anemia." Symptoms can sneak up slowly, making them easy to ignore until they're hard to miss. Diagnosing pernicious anemia starts with a blood test. Your doctor checks your red blood cells. If they're large and few, that points to B12 deficiency. They'll also measure your B12 levels directly. But here's the key test, checking for intrinsic factor antibodies. If those are present, it confirms your immune system is causing the problem. Another test looks for a substance called methylmalonic acid, MMA. High levels mean B12 isn't working in your cells. Treatment is simple but lifelong. You can't just take a regular vitamin pill because your body can't absorb it. Instead, B12 is given as injections, like a small flu shot, usually once a month. Some people use high-dose nasal sprays or sublingual, under the tongue, pills that go straight into the blood. Most people feel much better within days. More energy, clearer thinking, less tingling. Regular follow-ups keep things on track. Can you prevent pernicious anemia? If it's caused by an autoimmune issue, you can't fully prevent it, but you can catch it early. If you're over 50, vegetarian, or have a family history, talk to your doctor about regular B12 checks. Here's a practical tip. If you avoid animal products, take B12 supplements. A simple daily tablet or weekly dose can keep levels healthy. Eat B12 fortified foods like breakfast cereals or plant milks. For others, especially older adults, stomach acid decreases with age, making B12 harder to absorb, so supplements help here too. Think of it like changing your car's oil. Routine maintenance prevents bigger problems. Recent research is making life easier for people with pernicious anemia. Scientists are testing new ways to deliver B12 without shots. One study is looking at a dissolvable oral film, like a breath strip, that releases B12 directly into the bloodstream. Another trial explores engineered probiotics that produce B12 in the gut. Exciting, right? Researchers are also studying how B12 deficiency affects the brain long-term, and whether early treatment prevents memory issues. Genetic research is helping identify who is at higher risk before symptoms appear. Imagine getting a DNA test that tells you to monitor your B12. Now that is personalized healthcare. These advances mean fewer needles and better quality of life in the future.